is Lori Lancaster. I am a paramedic with Tampa City Emergency Services, and I am here today to do a video on allergic reaction. To my left is my junior Madeline, this is my captain Daniel, and this is my soon-to-be captain, but lieutenant now, Randall. We did have a few others, but the pager went off, so they left us. So today we're going to talk about allergic reaction. Okay, guys, tell me something about allergic reaction. What is it?
It's when somebody eats or has a allergic, or when somebody eats or gets stung by something or contact that makes them swell up and have pollen rashes.
Okay, what is something, Madeline, that can cause you to, what kind of food could cause you to have allergic reaction?
Peanuts, shrimp, medicine.
Just about anything, really. Just about anything. Okay, what's an insect?
Bees.
Oh, that's number one.
Spider.
A wasp.
I'm telling you, the bee put me in the unit for 5 days. It's no joke. What kind of environmental something? What's something that's in bathrooms more than anything else?
Mold.
It's black mold. A lot of people have mold and they don't know it till they start coming up with their runny eyes, runny nose, scratchy throat, and they start looking, trying to find out what's wrong with them, and they find the mold. What's something else? Dust. Who does not have dust in their house? You have to dust every day. If you don't, you can write your name in the dust, especially on the ceiling fan because it collects. Dust is bad. What about chemicals? What do we use?
Latex.
We use latex, okay? We have latex-free gloves now, but we used to not, and our hands would break out, especially if we were really busy on a lot of calls, taking them off and not washing them properly. Clothes, fabric softener. There's certain kinds I can't use. Dish detergent, washing powder, all of that. Those plug-in air fresheners, number one thing is a major cause. Now, the ambulance just pulled back up, it kind of scared me. But anyway, what's another thing that can cause, give me a sign or a symptom that can show you that somebody's having an allergic reaction?
Rashes.
Sneezing.
Yes?
Watery eyes.
What else? Yes?
Even just being itchy.
Just being itchy. Okay, what if, I'm sitting here going, man, my throat just don't, I eat them peanuts and my throat just don't feel right. Wow, my throat feels like it's closing up. Could I be having an allergic reaction? Okay, what do I need to take? Okay, why should I take Benadryl?
That's the first drug that you would take for an allergic reaction.
Okay, you want to tell me what the dosage is? Well, hello, Ariana. We are now,
Hello, Miss Lori.
we've got one of our juniors returning, and that's Miss Ariana.
25 milligrams, you take 2, so 50.
Okay, here is the Benadryl, and how are we going to take these?
Orally.
What's orally?
Mouth.
In your mouth. I'm going to just pop them in my mouth and swallow them down, right? Okay? And it works. It takes care of it. But they're also saying that the paperwork that I read that Benadryl should be set aside and go to Zyrtec and Claritin because it's safer, more effective, and it's cheaper. It causes less drowsiness, and it doesn't cause the constipation, the confusion. Benadryl makes you sleepy, right? And when you get in that almost good sleep, do you have a good level of consciousness or you got an altered mental status?
Autoimmune status.
It does, and it really does make a difference, especially in children and senior citizens like myself. Okay, push. All right, tell me something else that you can do to treat not anaphylactic, but allergic reaction.
Here.
You're going to use the EpiPen. Well, but I'm not in anaphylactic. I'm not in anaphylactic.
Wash it good.
There you go. There you go. All right. Well, while we're doing this, I have now just, oh my gosh, my throat's closing up. I'm just broke down in sweat. My blood pressure's going down. My heart rate's going up. What am I doing?
You want to
Okay, then Madeline, what you gonna give me? Epi. What's the dosage for Epi, Ariana?
0.3.
Okay, and how you gonna give it?
In the inner thigh.
Okay, alright, Daniel, my captain, slap it on Rambo and show me how to do it. But you gotta get up in front of the camera now. Tell me what you're doing.
To the inner thigh, hold it for 10 seconds.
Ooh,
Once
close
you hold
to
it for
the
10
finish.
seconds, and then pull it back out.
Okay, now, why can't you do it on the outer side?
Because it does not enter into the bloodstream as fast.
Okay, alright, now, we're using the Epi trainer. What if we don't have a trainer, what we're gonna use? We're gonna use these little bottles I've called. This one's adrenaline. It is Epi 1 to 1,000 or 1 to 10,000? 1 to 1,000. What you do, guys, is always make sure it's got a cap on it, okay? Because I know y'all not done this. Alright? Pop the seal off, set it down. Always get your alcohol wipe. What should I have on?
Gloves.
Why?
Because it protects you from any infectious agents that you might get from a patient.
Okay, I'm gonna draw up 0.3. So I'm going to the 0.3 on this needle. I don't have to wipe that off, but okay, I'm gonna wipe it off with alcohol anyhow. Pop it through right in the very center. Push the air in. Pull the needle down just a little, and then I'm gonna pull the needle back, okay? The needle long. Alright, a little bit more. Then go back to the 0.3, pull it up, click it off. Do not ever freak out. Why?
Because you could accidentally stick yourself.
You definitely. We have a sharps container that has a needle thing in it, and we just twist it in the needle and pull it off. If they do not have an IV and you have to give it to them, get you a fresh needle and you put it in. Now, where would I give this shot to? You need to come up this way. You see where that big old knot is, the shoulder joint? Go 2 finger widths down, clean it with alcohol, go straight in, straight. Don't go in at an angle, hook it straight in, and then you just slowly push it. Pull it straight out, and you rub it in, and then you do what with this. Put a sharps container. If you get stuck by a needle for anything, you report it to your
Infectious control agency.
Please make sure you tell somebody you get stuck. Now, when I look at this medicine, make sure y'all all got a bottle. Okay, pass your needles. Alright, now what I want you to do is, I want you to look at your needles. Everybody got one? Okay. Now, what I want you to do, Jesus, see, I'm about to stick my own self. What I want you to do is look at your medicine, okay? First of all, there's 5 things that you need to do about your medicine. The right medicine, the right dosage, the right time, the right patient, and the right route. The 5 R's, okay? The right medicine, ma'am?
The right documentation.
Oh, always document. Please always document. So this is Epi, you know, that's the right medicine. The dosage on these bottles is 1 milligram, so that's, we're not gonna be able to give it all because we're only giving 0.3 milligrams. So look on your syringe. Do you see the little markings where it says 0.1, 0.2, 0.3? So you're gonna go down to the top of the black stopper is right on that 0.3, okay? Now what I want you to do is hook your needle and your syringe together. Take your little plastic cap off your needle. open your needle. Okay, now, you got it all together. Now, pop your cap. Stick your needle straight down into the very center. Very center of it now, okay? And pull back 0.3 milligrams. You need to put it in the dead center now, because if you put it to the side, most of the time it bends the needle. 0.3 milligrams. And if you'll turn it the other way, turn it upside down, where you're looking at it, it draws down better. Did you put your air in it? Okay. Well, it'll pull down. It's just harder to pull. Okay, everybody got their 0.3?
That's right, isn't it? Or the top of that box.
No, this black's,
It doesn't know that.
you got a big old air bubble in yours, but yeah, this part right here, right where you got it, that's right. That's good. What you got?
I got it.
Alright, now take your medicine off. Be careful with that needle. Be very careful with that needle. Okay, now, I was gonna bring an orange where you could stick it, but I forgot about that, sorry. A what? Brad can hold it. You wanna go stick Brad? Can you move that show for Brad? Alright, come on, let's go to Brad. Okay, here's Brad. Alright, now Brad is having an allergic reaction, so what we're gonna do is, here's Brad's deltoid, 2 fingers down. That needle's not gonna go in this tough skin, but take the needle off. Take the needle off. Alright, now, clean the area good. Straight in, 45-degree angle. Straight in and shoot it. Pull straight out, wipe it down, sharps container, okay? Same thing, next. And gotta clean it. Don't forget, gotta clean it. Now what you looking for? See, here's his elbow joint, so it's 2 fingers down, right into the deltoid. Yeah, straight in. And look, once you go with that needle, slap it in there. Don't just break the skin and slide it, because don't your needles hurt, okay? All right, Miss Ariana, 45-degree angle.
Oh, Miss Lori, can
What
you kind of help me set this off?
Sure. All right, where's the cap? Give me a cap. I don't like playing with needles. She put that one to the head. Okay. There's yours back.
Okay, clean it and then put it right here.
Okay, now, what I want you to do is, when you pop it in the skin, straight in like a dart. Go in, don't sit there, break the skin, and just put, y'all, them needles hurt, I'm telling you. Then what you need to do, clean the area back.
Yep.
Okay, Miss Madeline, your last turn. Here, I'll take your needle. Thank you. Straight in, clean it, yes ma'am, yes ma'am.
Push it.
Yeah, it ain't nothing but adrenaline, it's not gonna hurt nothing, there you go. And then you clean it back, that's all you gotta do. Okay, now we're gonna go back to the table.
You want us to put it in the sharps?
Yeah, I'm gonna put it in the sharps container.
I'll put them right in.
There's a sharps container right there on that desk, Ariana, if you will grab it for me. And we'll put them all in there, and that way we'll be accountable for them. Okay, now, since you draw this medicine up, what do you need to do to this patient?
You need to reassess his vitals.
Okay, why? Anytime you give a patient medicine, always reassess their vitals. There's 3, 4, I need another needle. Is that all the needles? Just
Yeah.
4, where's mine? Good. Okay. Mine.
Put it back.
Just, you can just set it right there, thank you.
Yes, ma'am.
I just wanna make sure we got accountable for all the needles. Okay, keep your trash. so, remember, recap, your epi 1 to 1,000, you give how much? 0.3. And you should see the patient get better pretty soon, okay? But they're not. They're not. Okay? So now they're having trouble breathing. They're like really wheezing. I mean, just hoarse. See, I can't even do it. It makes me cough. Okay? So what's the dosage for albuterol?
2.5.
2.5. Okay? With that albuterol, how are you going to give it?
You would take your oxygen tank and you would have a
There you go, sir.
Ready
Put it
to-
together for me. Show me how to do it. And while he's doing putting the nebulizer together, what's one thing that y'all need to be, since he's having trouble breathing, who do you need to call? Don't say Ghostbusters. Okay? Why? Because he's deteriorating, right? Okay, he's over your scope of practice, so you need to make sure you call for more help. Well, we've done the Benadryl, we've done the epinephrine, and now we're doing the albuterol. And what dosage did he say? Okay, do you think that'll help with the wheezing? We don't know. It should, but we don't know. Okay? But they're expired ones, so we're just using whatever we can to practice with. I don't know. You know us, we always have expired drugs, and that's what we practice with. That way when you get on the boo-boo bus, you got the real stuff.
That's right.
There you go. Alright, I have went from my wheezing to difficulty breathing, and now my lips are swelling shut, my eyelids are swelling, I'm having trouble breathing, the breathing treatment's not helping, the paramedics are stuck on a 5-car pileup. What can y'all do for me?
really nothing except for
Yes, you can. You can always treat me. What can you do? Treat for shock, which is what?
Give you some oxygen.
Okay, you already given me a breathing treatment. What are my hands?
Cold.
So what you gonna? There you go. How many liters you gonna put that on?
6.
Okay, it's supposed to fall. Go up to 8, make sure it falls. Okay. Now, take that mouthpiece and put it on the other end to where you can take your hose and bend it up. That way, no matter if they're breathing in and just kind of like puffing, what's coming in out of the other end will go to the nose. So they're getting double the dose. And then cut it off because we don't need a breathing treatment on please. That's the actual albuterol. Yes. Yes, that's actual albuterol. What do you think their heart rate's gonna be?
It could be anything, it could be way up there.
It's more than likely it's gonna be an increase. Do you think they're gonna be dizzy or lightheaded? Epinephrine's gonna speed everything up, right? Okay, you've already given Benadryl, that's antihistamine, so now you've given the, epi, so more than likely they're gonna be jacked up, right? So the hives have moved over everywhere and it's not working. Who do you need to call if you've done all this and you're the only one there? It's just me and you, 2 basics on the truck, and everything we've done's not work.
Medical director.
Who's our medical director? Who's our medical director? Who's our medical director? Who do you call? Or your medical director, but who is that?
A doctor.
The doctor.
Okay, at where?
Hospital.
At the yes, it's your ER doctor. Even though Dr. Chambers is our medical director, he's Dr. Chambers. If he's not the one working, you call, hey, this is Lori at Tabor City, can I speak to the ER doctor? Hey doc, this is what we've got, this is what we done, what you want me to do? He'll say, load and go, give him, okay, he's just told you to give him another dose of Benadryl.
Give it to them and document.
And there's your key word right there. What if I don't document it and something happens to that patient? Who's gonna be liable?
You.
Why?
Because
There's nothing to prove that you, if you don't document, y'all, I'm telling you, you gotta document everything. Okay? Now, we have done severe allergic reaction, which is, turns into anaphylaxis, and you've done the epinephrine, you've called 911, you give them oxygen. As a higher level of care, I can give IV fluids and give them other medications. What about Solumedrol? You know, the little orange bottle that you push through? I know you've seen it on the back of the truck. It works. And more than likely, that's something you'll be given. That is something new, because it's a steroid, and it will help. I looked up the North Carolina OMS protocols to make sure I didn't miss nothing, because I didn't want to be telling you wrong. You know, because that happens. And it says the anaphylaxis is an acute, potential, lethal allergic reaction. So if you don't get them back, what are they going to do? Okay, what is something that we can do? Drug of choice, of course, always is to give your epinephrine. We've always been taught you do the Benadryl, then if that doesn't work and they progress on to anaphylactic, you give that epinephrine. But what if you go to them and they're already got hives all over them and they got the, hit them with the epi and go on? Why? They've already passed that normal stage. They've gone up to the hello, help me quick stage, right? Okay? Then once you give that, if it's mild and moderate, of course, start with your Benadryl. What's always your first drug choice?
Oxygen.
Why?
Because everybody needs oxygen.
You gotta have oxygen to breathe.
To breathe, right? But if you calm them down, you think they'll calm down? I think so too. Allergic reactions may occur, respiratory and gastrointestinal symptoms when they have no rash. If they have a rash, it's something else. A lot of times when we call for our paramedics, that's because it's already past the allergic reaction and they moved up to the anaphylactic stage. When I got stung by a bee, I was mowing the grass, minding my own business. I didn't care. The bee popped me on the head. Well, I still had a half acre of yard to cut, so I just kept cutting until I passed out on the lawnmower. If I'd have got off and took the medicine to start off with, maybe I wouldn't have ended up in the hospital. Sorry. If I'd have went out and got off the lawnmower and took my medicine, then probably I wouldn't have had to do that. Madeline, will you take my phone to Kayla and tell her to call Zach and let him know that I'm in class? Thank you. Sorry for the interruption. Okay, now, once we do all what we've done for allergic reaction, then we come back to typical signs. I just want to review. I found this on the internet. It was kind of interesting. What are the 3 A's of anaphylaxis? Awareness, avoidance, and action. Awareness. Okay, if you know you're allergic to peanuts, then don't eat peanuts, right? Okay? Kayla's mama Donna is highly allergic to shrimp. So when she goes to a seafood restaurant, she orders a steak. But what's that chance of her having something cooked where the shrimp was? Okay, so you gotta be careful. Everybody loves a good old Snickers candy bar. Okay? But if you're allergic to peanuts, you can't have it. My sister is allergic to IVP dye. She had a stroke 2 weeks ago and she had to have a CT scan. They gave her all this prednisone and Benadryl and gave her the CT scan. So what happened to her? She's doing this number. And they gave her medicine to prevent it. And I'm like, why you gonna give somebody something when you know they're allergic to it? Well, which was more important? Find out if she had a stroke, she had a bleed, or deal with allergic reaction. Okay, so there is some things you have to bend. I didn't say break, I said bend. But that's when you call who? Please, people, do not get in trouble or trying to be Mighty Mouse or whatever. call your medical director. If you're on the truck and I'm not with you, pick up the phone. Okay, this is what I got, what I need to do, okay? Because that's what we're here for each other. You're learning, okay? Another thing with the awareness is it says you're supposed to educate others. Isn't that what we're doing? We're sitting in class trying to learn something. Okay, Madeline, when it says avoid something for an anaphylactic, how can you avoid something? Read the label. This label says it's got peanuts. I'm allergic to peanuts. Well, don't eat it. Okay? That's simple, right? If it says, if I know that I'm allergic to Clorox and it's supposed to go in that wash machine, guess what? My clothes ain't going in there. Why? I'm avoiding something that can hurt me, right?
Tell your people at your restaurant, like if you have an allergy to shrimp, tell them that you have an allergy to shrimp.
Please don't put no, I love shrimp, so I don't want to be allergic to them because it would hurt my feelings. But I ain't no different than nobody else. Okay? So when you take precautions, when bees are around, I have an EpiPen. Mine's not an auto ejector, mine's a real EpiPen. And there's one in my car, there's one in my backpack, there's one in my tackle box, wherever I go, an EpiPen goes, because it's that bad. A lot of people, one is it, that's it. Latex gloves, when you ask somebody on the back of that ambulance shop, please ask them, do you have any allergies? Make sure you're writing those allergies down. Make sure you're writing them down, because people need to know, okay? If the doctor says, oh, well, they're not allergic to anything, so let's go ahead and give them some penicillin for the rash and blah, 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 and guess what? The penicillin is what gives them the rash. So you have to ask. If Daniel doesn't know what he's allergic to, yo, Miss Jessie, what's Daniel? Ask, the neighbor, ask. There are people around him, okay? You have to, and then, what's the one thing you gotta do? Document.
Another thing, a major thing is a lot of people wear like alert bracelets, alert necklaces.
Okay, I'm glad you brought that up. Oh, let me find mine.
Because
That's
a lot of
right
people
in my
have stuff
sleeve.
in their phone.
Yes.
Your medical ID.
This is a Hero Link, and wherever my phone is, you slap any phone on top of it, and it'll pull up what my name is, my blood type, all my allergies, past medical history, because my blood thinner, people have to know that I have a port, that I'm a factor V bleeding disorder, because that's life-threatening. That's the same thing with allergic reaction. Allergic reaction can become plain and simple 1 minute and kill you the next minute. So you have to make sure you know your signs. Another thing with the actions, that was one thing that really, really surprised me, is because what do you need to carry if you know that you're allergic to something? Okay? Do people carry them? Do people have medical alert bracelets? Some do, but a lot don't. But see, for what medically I went through last year, I wear my bracelet, okay? What if you didn't know me and you come up to me? Would you know that was a medical alert, even though it's got a star life on the side of it?
If you're conscious enough, ask, do you have any kind of bracelets if you're not well enough to speak?
Exactly, okay, but I'm unresponsive, but Madeline's with me.
Do
Hey
you
Madeline,
know-
do you know, hey, that emergency? Ask. What they gonna do? They either gonna say yes or no. You know, people get upset, I know, I understand that. But you have to be calm, professional. Remember, you're there to take care of that patient. Okay, another thing, by focusing on the 3 A's with individuals and caregivers to prevent and respond to anaphylaxis, remember, you're there to save a life. Okay? Your actions will make a difference. Okay? Right? Now, another thing, what about allergic reactions on your skin? Yeah, girl.
Poison ivy is a main one.
Hallelujah. Don't it hurt?
Yes, sir.
Didn't you have it last year?
Yes, sir.
Okay, and what did you do? You took the most oatmeal baths you ever had in your life, didn't you?
And the creams that they give you.
It'll last about 10 minutes.
Yeah.
That's it, okay? Now, once you've done, my son's bugging me. Once you get all this down with your skin reactions to allergic reactions, what about fire ant bites?
Yeah.
Look for
Itchy.
Fire ant bites, they're very painful, right? A lot of children playing in the yard. Well, they don't want to come in and tell mama they got bit, but I don't say how because they hurt. But that night when you're giving them a bath and you see these little dots on them with the little pus heads coming up, what you gonna do? Put a little Benadryl cream on it. Number one, it's gonna calm it down. It didn't say they were in anaphylaxis, but they're having a reaction to it because they got a foreign substance in their body, right? Right? Okay. Then corticosteroids. That's a big word. That's a Benadryl cream. They have different brands. Whatever helps. Poison ivy, poison oak. They're very painful, and all you want to do is scratch. But if you scratch, you leave sores. You leave sores. You leave scars, and you will spread. Wherever you're scratching and touch, guess what? You just moved it. So, Ariana can tell you that firsthand because she had it last year.
It spreads very easy.
And I'm not going to tell you what she was doing in the woods, but I bet she won't be going in no more. What you think? Nah. Okay. But anyway, she wasn't. She wasn't being mean. I was just playing with her. Okay. What if you get the swelling where that fire ants was and it's all swollen, now it's got blisters? Do you think you need to go to a doctor?
Yes.
Okay, because the infection's spreading, right? Telling you, you got to think about what you're doing. Okay, what about if you're having a reaction to food? I gotta quit saying that thing. What if you're having a reaction to food?
Tell somebody.
Okay, but what else? If you've got tingling in your mouth, your lips are swelling, your stomach's hurting, oh now I got to throw up. Whoa, that sounds like a ramble going down the highway. Yeah. You got hives, you're breathing difficulty. What's something I can do?
Go ahead and take minutes.
Okay, but you know what else I can do that I wouldn't have to swallow? Avoid it. Not to do it to start off with. If you know you're allergic to something, then don't do it. But we all don't know what we're all allergic to. I took Compazine, which is a medicine for nausea. Okay? I was in the hospital. And within 5 minutes of taking that medicine, I seen snakes crawling, coming out of the ceiling, coming down the wall, crawling across my bed. Guess what Lori don't take no more? No Compazine. They said the dosage was too high or whatever. I don't care. I don't want another dose in me. If something's gonna make me see snakes crawling, I don't think so. I'm not
Lori
putting.
don't like snakes.
Lori don't like snakes. So what am I doing? I'm avoiding something. No, I'm not allergic to it, but the way it made me react, yes, I am allergic to it. Okay? When I had blood clots in my leg, they gave me morphine for the pain because the blood clot had stopped blood flow. Well, put it in the IV. Within seconds, here comes all these hives on my arm, pure wells. So guess what I was? Now I'm allergic to morphine. So am I going to take it again? So that's another thing I'm going to avoid. So that's what you have to do. If you know you're allergic to it, or you take something and have the symptoms, you don't take it the second time. So we're going to recap a little bit. Tell me a major medication that a lot of people are allergic to.
Penicillin.
It really is one of the most things. Other than Benadryl, what's the antihistamine that you can take for allergic reaction? That's my girl. What's some of the signs, Ariana, that they look for that you're having a reaction? Just give me one.
Itchiness.
Okay, they're itchiness. Is that a word? They're itching. Okay. Maybe what's another one? Don't tell me itchiness.
Redness of skin.
Redness to the skin. Come on, Mallet. Y'all got the yellow fevers? Shortness of breath. What's another?
Swelling.
What kind of swelling?
Your throat could be swelling, your eyes could be swelling up, puffing
A
up.
lot of times them eyes get real puffy and the lips get puffy, especially if it's mouth. If it's lotion, when I took the what was that medicine? Oh, I don't even remember. But I had a rash to break out when I had shingles, so I thought that was just a part of it. So, but it wasn't. And now, Benadryl cream, oh yeah, that stuff's good. It works really good. We're almost done, guys. We're getting there. Just a few more, one more page. Look at there, one more page. Okay, now, when it comes to documentation, y'all know I do some reports every day. What's the one thing that you have to have on your documentation?
8 times.
Date and time. What else? Tell me something else that you need to document.
The medication you gave them.
Okay? Was it the right medicine? Was it the right dose? Was it the right patient? Was it the right route that you gave it? You got to look at the expiration date. Well, this was 11/25. Oops. Poor Brad, we just gave him expired drugs. Poor fella. But he didn't feel a thing of it. Because we didn't use needles in bread. It cost too much money. Okay? But when you go to, everybody feel your shoulder bone. Feel that big old knot there? Now take 2 fingers below it. Come down now, come down. That right there, that little soft spot right there, that's where you put that needle in. Straight. Don't go this way. You got to go straight in. And don't be sitting there going, they'll poke you, just slap that needle in there and get it over with. Because a lot of times patients will jerk. And if you just barely have it in the skin, it's going to fall out. Okay? You're taking this needle, and when you pop it in, and the needle's in there, when they move, well, you already got it. But if you just barely break the skin and they move, what's going to happen? Guess what? And then this is going to be bleeding. And they're going to have a scratch, because that needle right there don't play no games. Which I wouldn't stick that with a patient, but that's what we had, so that's what he used. But what would you do with this? You put it in him, and then you pull it out. You put the needle in the sharps container. What else you need to do?
Put this in the trash.
Okay? But if you don't document what you've done, you ain't done a hill of beans. Okay? You've got to document
It ain't on paper,
everything.
you ain't done it.
That's one thing that I've been told since I've been in EMS. If you don't document it, you've not done it. I pulled the North Carolina OEMS allergic reaction, and it said that the history, onset and location, you need to know if it's an insect, sting or bite, food allergy, medication, new clothing, past history of any other reactions, past medical history, and just a regular history of today. Have they ever had an allergic reaction before? Have they tried any new soaps, creams, eaten anything different? You know, you need to ask. I know it's boring, but you have to ask. Okay? What about your signs and symptoms? Patient had itching with hives over the front part of his chest and down both upper arms. But you get to the hospital and they're covered from head to toe. So it's progressed worse, right? So if you don't document it, how's the doctor going to know there's been a change in it? When the patient was given Benadryl, the difficulty breathing, the itching stopped, the patient improved, or the patient became severe short of breath, wheezing noted, albuterol given via nebulizer with your dosage and how you gave it. You have to document each step you do. If you don't document, you didn't do it, right? Right, guys? Okay? Another thing is you always treat for what?
Shock.
Shock.
Why?
Just don't put you in shock. It's not necessarily, but.
When I get on the back of that ambulance and after you treat a patient, honey, are you cold? Here, let's cover you up. Give them comfort. That's a rough ride.
And then it calms down.
Every one of you's been in the back of the ambulance, right? So you know, it's a bumpy ride. Okay? It is. It's a bumpy ride. So what I want you to do is make sure that you know, number one, your signs, what to look for, how to treat it, and how to make sure when to document from a regular allergic reaction all the way up to anaphylaxis. Because if you don't, that's the difference between life and death. Anybody got any questions? What Well, we got 5 more minutes to talk, so somebody better ask me something, guys.
Then you just good teacher.
Oh, I hear
You just explained everything. so-
Okay, now.
If you're having an allergic reaction and you see like a cough or something somewhere, do they carry like your EpiPen and all of them?
No,
They don't.
they do not. The only thing, well, Columbus County cops don't. Only thing Columbus County cops carry is Narcan.
Okay.
But, of course, they can get you to whoever faster. You know, the blue lights people get out of the way. Well, supposed to. Should call somebody. You know, if you think you're having an allergic reaction, not just that you got this little scratch, you know, you got hives breaking out, your throat's closing up. Don't wait till your throat closes up, because if you do, it's gonna hurt worse. It could cause more problems. If you think you're having an allergic reaction, call 911. Yeah, that's the number. Call 911. Anybody got any questions? Y'all done awesome. I really appreciate y'all's help. That's all we've got on allergic reaction. Thank you. Hope you've learned something.